Welcome. Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid. The subject of this article is ADHD, a disorder or a neurochemical uniqueness. ADHD, of course, stands for Attention Deficit Hyperactivity Syndrome, a situation which is increasing in its incidence at a frightening rate in all chemicalized regions of the world. When I see a child who has been diagnosed with ADHD by the school psychologist or a nurse or a pediatrician or a psychiatrist, the first thing I tell the child, and the children really understand this very well, and of course I also tell this to the parents. We have a choice. We can either consider a disorder, a disease, attention deficit hyperactivity disorder, or we can consider it as a neuroenergetic, neurochemical uniqueness. I think I was about 40 or 42 years old that one of the brightest pediatricians that I've ever met, Dr. Francis Wakeman, he listened to one of my lectures and he told me that, you have ADHD. And I said, Frank, I don't know what that is. He said, you're not serious. Nobody ever told you? I said, when they were teaching in medical school ADHD, I must have been ADDing myself. I don't have any concept of that. But on a serious note, I would not trade my ability to multitask, multi-process ideas, thoughts, narratives for anything. I wish I understood this myself better when I was in my 30s or 40s, when I knew so much about diseases and knew nothing about health. I used to suffer migraine headaches. I used to shoot myself with Demerol and Vistro. Demerol is the most addictive drug that I know. Fortunately, I did not develop addiction to it. I had problems of hypoglycemia. I was severely allergic. Somehow I was able to do my work as a chief pathologist, and that kept me out of trouble. So the main message to people, children, teenagers, adults who've been diagnosed with ADHD is you have choice. You can reject this diagnosis. You can dismiss this notion that some genius has diagnosed a disease in you. You can learn to recognize that your uniqueness, neurochemical, neuroenergetic uniqueness, creates certain strengths for you. I just mentioned to you, people with ADHD, they are multitasker, they are multi-processor. They can turn 3 or 4 things in their heads at one time. I will tell you that I could never focus on just writing one book. And all the close to, I think I've written 37 books. All those books that I wrote, I was always working on 2 or 3 books at a time. And I'm sure that many of the astute viewers of this encyclopedia have recognized that I'm distractible. I cannot follow any scripts. When I do the program, I just think of, there is an image of a person and I just describe that image to you. But there is a great advantage in your considering it as a neurochemical uniqueness rather than a disorder diagnosed by so-called a professional. You are free. You know that there are some positive things. You also know that distractibility can create problems in school, at home, mood shifts. Now, in other segments of this series, this program is a part of 10-segment series on ADHD. I think if you looked at each one of them twice, let's say in the next 3 weeks, you'll get a very clear idea of what my patients who were labeled with this situation have taught me. They have been my true teachers. Of course, I also look at these things through what my microscope taught me, what my laboratory analyzers taught me. And in some way, when I think about the oxygen homeostasis in the brain, neurotransmission in the brain, not neurotransmitters, but neurotransmission, which is the process under which substances called neurotransmitters like serotonin, dopamine, noradrenaline work. That's a crucial distinction. So I want to celebrate the gifts that nature gave me. I would like to be aware of my handicaps in terms of distractibility. But this idea of not being able to focus, I don't know if that's really a handicap, because I think when other people think we are not focusing, we are actually focusing on other things. We just learn differently. So that's the second core message, that if you're very frustrated with your child who's been labeled with ADHD, that child learns differently. Now, the last point I want to make in this segment is that I will discuss the issue of when and how to use medication for it. Sometimes it really does become necessary, but only for a short period of time. The real issues are issues of gut fermentation, mold allergy, food allergy, negative food reactions, nutritional deficiencies, and fermentation in the blood and fermentation in the liver. And I devote other segments in this series to those crucial subjects. Children's Health Core was a foundation started by my wife Talat and I some years ago. Our vision was to provide authentic information free of cost for children worldwide, as well as for their parents and their grandparents, their aunts and their uncles, teachers. We ask for your support. You can forward this YouTube segment to your email contacts, other parents, children who've been given this label, teachers. I don't think this is a psychological problem. I think we should just outright reject that notion. So support us. If you wish to do more, please send us an email how you would like to participate in our effort. We invite you to do that. Our email is aliacademy7@gmail.com. aliacademy7@gmail.com. 7 is the number. Thank you for joining us. Until we meet again, may you be gracious, graceful, and generous in your spirit. Thank you.